I am Dr. Harpreet Bakshi, and today I'll be discussing about a very common condition encountered, that is dark spots and pigmentation. To begin with, I'll just start with the various types of pigmentation. The most common types of pigmentation are: number one is the freckles and photomelanosis. That is mostly because of sun exposure, and if you're not careful, you get these freckles and photomelanosis. Second is PIH, or that is post-inflammatory hyperpigmentation, and that is because of inflammation, that is maybe acne, or some people have this habit of scratching their face, so that leads to inflammation and pigmentation. That comes in that category. There are certain dermatitis conditions also associated with pigmentation. Another important condition, that is melasma, when it is seen in both males and females, and in melasma there are some patches on the face, on the cheeks, nose, maybe on the forehead also, and that is very common in post-pregnancy as well as hormonal changes. So that is also very common condition, melasma. Other causes of pigmentation may be drug-induced pigmentation. Another causes are acanthosis nigricans, which occurs on the neck areas at the back, and there is a velvety kind of pigmentation, occurs more commonly in diabetics and in obese individuals. Other causes of pigmentation are smoking, vitamin B12 or iron deficiency, which can also cause hyperpigmentation and dark spots. Prevention is always very simple and easy. You need to follow the basic principles. That is, one is sun protection. You have to use a good sunscreen, protect from sunlight, use sunglasses, use a hat, big hat, to protect from the damaging rays of sun. Also, constant heat while cooking, as well as steam and sauna, that should be avoided. That is also damaging to the skin. Also, constant scrubbing and friction over the face may also lead to hyperpigmentation, and that also needs to be prevented. Some cases there is fragrances and use of deodorants. Prolonged use may also, or cosmetics, fragrances may also lead to, that can also be prevented. Also, avoiding smoking and stress, which also leads to pigmentation. Coming to the treatment of dark spots and pigmentation, starting from chemical peels, there may be different peels are designed for pigmentation depending upon the depth of pigmentation, and sequentially they can be used, superficial to deep peels. Lasers, especially Q-switch and ND-YAG laser, is in the form of carbon peels, and other forms can be used. Mesotherapy, that is injecting certain growth factors and other chemicals to improve the skin quality, is also a very important method of treatment. IV glutathione injections, tablet tranexamic acid, that is very standard and the latest in the field of treatment of dark skin and pigmentation. Also, microdermabrasion in some cases may be very helpful in superficial pigmentation. There are various creams available in the market for the treatment of pigmentation and dark spots. To name a few, like Melaglow, Banatan and D-Melan cream, they are pretty effective, but they should be used at night time. They may be available over the counter, but always under the prescription of a clinic they should be used. Otherwise, the effect is not going to be that good. What are the basic ingredients in depigmenting creams? The basic ingredients, they have alpha-arbutin, niacinamide, kojic acid, glycolic acid and lactic acid. These are the basic things which may help in the depigmentation and help in improving the texture and the pigmentary spots. Along with this, the treatment of also involves oral supplements like IV and glutathione, which can be oral or as well as IV also can be given. Vitamin C and vitamin E can be given. Grape seed extract is also very commonly used. Green tea extract is used. Extra xanthan as well as lycopene. So generally, the treatment depends upon the type of pigmentation. If it is mild, then we can start with these creams and these oral supplements. If it is deep pigmentation, then we need to do some procedure in the form of chemical peel, or we can do some carbon laser, which is very common, Q-switch laser in the form of a carbon peel. and these things can be done, and in between for maintenance we can use the creams as well as these oral supplements which are very effective. So we need to form a complete procedure protocol for the treatment of pigmentation, which has to be individualized according to the requirement of the patient. So I'll be showing some of my cases as well as some of the basic treatments which are available at our center. So just kindly have a look at it. That has been done. Just see the shine and the texture of the skin, which is showing improvement, if you can appreciate.